So parents ask me a lot about doing different types of testing. And so some of the things I look for when I'm deciding if we should do lab testing and which test might be the right fit. So really any kind of chronic digestive issue. So if any patient of any age comes to me with constipation, with diarrhea, with bloating, with belly aches, it is not normal for us to have belly aches. So if your child or yourself has that sort of symptom, those are things we definitely need to dig into. There are lots of other physical signs that I look for, um, you know, such as eczema and little white spots on the fingernails. But if you have a child who isn't sleeping well, if you have a child who has skin issues, if you have a child who is a very selective eater, they might eat 5 things and it's macaroni and cheese, chicken nuggets, and pizza, right? These are reasons for us to look a little bit deeper into doing some lab testing.
Do you ever use needles?
Do I ever use needles? That's a great question. So, over the years, what I have learned in my vast clinical experience is that needles are hard for kids. Needles are hard for some adults. So, what I have really worked to do is to find tests that don't require needles. So, like I have mentioned before, we use urine, we might use saliva or stool. Um, Sometimes I do need to draw blood. And in those cases, I'm very, very thoughtful and intentional about, does the benefit of getting those test results outweigh what we might put the kid through in terms of a blood draw. If it's absolutely necessary, I try to do it myself if the family is local, because I can take my time, I can be patient, we can use numbing cream, we can make it as easy of an experience as we possibly can. For those families who live far away and I order blood work, I can mail you some numbing cream. I mail you an order so that you can have it done locally. So we try not to do needles, but when we have to, we try to make it as easy of an experience for the child as we can.